I'm Brittany Lewis with Forbes Breaking News. Senator Tim Kaine spoke with drug policy experts about fentanyl and opioid addiction treatment during a Senate Help Committee hearing on Tuesday. He spoke about treatment for incarcerated individuals and said that many sheriffs he asks believe that around half of people in jail are not actually bad people and should not really be in jail. Drug use has been highly criminalized in the United States, leading to the highest incarceration rate of any country in the world. Kaine's line of questioning implied he would like to see the opioid crisis in the U.S. dealt with through a public health approach rather than a law enforcement approach. Take a listen to his remarks.
Thank you, Chairman, and thank you to our witnesses for being here today and for your important testimony. So my states, like others, I've heard each senator talk about the tragedy of this in their states. There were 2,656 overdose deaths in Virginia in 2021. It was a 15% increase from 2020, and fentanyl was responsible for 77% of those fatal overdoses. So we're all grappling with this, and I appreciate the testimony, and colleagues of mine have asked many questions that I was going to. I wanted to ask a question about a strategy to deal with this issue, Dr. Delphin-Rittman, that we've talked about before. The last time you were here, I asked a question about connecting incarcerated individuals to treatment services, and in particular about drug courts. You shared information from SAMHSA's drug court program, and those are programs, most of us have them in our states, work to divert individuals from further involvement with the justice system into behavioral health treatment that is more likely to lead to a successful outcome. When I meet with sheriffs in Virginia, I always ask them this as the opening question: what percentage of people in your jail shouldn't be there? I don't have to describe my terms. I don't have to define what I mean. They know what I mean. They know that I'm asking, well, what percentage of people in jail aren't really bad people, they're not really crooks, they're not criminals, but they're people with substance use issues that have either been diagnosed and not treated, or not effectively treated, or in some instances, never diagnosed. I've never had a sheriff give me a number less than 40%. And often sheriffs give me numbers 50, 60, 65%. Since 2017, Virginia has received 4 SAMHSA-supported grants for drug courts, one in Lynchburg, Harrisonburg, Richmond, and Abingdon in far southwest Virginia. And I've been to some of the drug courts to talk to them about what they do. I've been to some graduations. In fact, I've been to 2 graduations in the last couple of years. In one, the drug court program was started by a local circuit court judge whose child had died of a drug overdose, and that led her to spur the effort to start it. And in the other one that I went to, one of the probation officers who works with the drug court program came up to me and said, and this is my second graduation this week. And I said, I thought this county only had one program going on at any one time. And he said, we do, but my first graduation was my son graduated from a drug court program in another county. And here's the one where I'm the probation officer, and I'm here because I'm proud of my graduates. Talk a little bit about the effectiveness of the drug court programs in SAMHSA. There's funding issues. Do we have enough funding to operate them? I happen to believe the monies we invest in these are some of the best investments we make. But if you would, Dr. Delphin-Rittman, talk about drug court programs.
Yes, thank you for that question, and just for all your work in this area. I mean, what we find and what we know is that drug court programs, they make a difference. They make a meaningful impact in people's lives. That it's an opportunity to reduce further penetration into the justice system for individuals that are struggling with substance use challenges. It's an opportunity to connect people to evidence-based services and supports, to include medication-assisted treatment, and to really change the trajectory of an individual's life because they're able to get that treatment that's critical. As you know, we also do in-reach programming.
Yep.
And so the in-reach programming is for individuals that are connected or further along and maybe before release, whether it's from jail or prison, we work to connect them to services and supports to include buprenorphine if necessary. In fact, right after this hearing, I'll be flying to the national annual meeting of drug court professionals, and we'll be doing a series of meetings with different court groups related to their work. This is vital, life-saving work, and this program is coming up for reauthorization as well. So certainly appreciate the committee's commitment and interest in this area.
Please pass on, as you go out and talk to drug court professionals, the the respect that we have for the work that they do. Here's a question dealing with fentanyl coming into the United States from abroad. What can you tell us, particularly those with the National Drug Control Office, what can you tell us if there's a pie chart? Some come by mail, some come people smuggle over the border, some maybe come around the borders. But I understand that huge percentages of the fentanyl that come to the United States come in across our ports of entry in vehicles, because we only inspect one out of every however many vehicles. Cartels figure they can play the odds, and they can actually just smuggle it right across the border through ports of entry. Can you share what the data is about that?
Yes, Senator, and it's an understandable question, but I'm afraid it's an unknowable question, because the only thing that we can calculate is what we see and what we find, right? But your characterization of vehicles is correct, but I think for a different reason. Our Customs and Border Protection do have the ability to be able to do non-intrusive detection that's very impressive. I was down last fall in El Paso, and you know, the non-intrusive detection capability that they have is very good. But more importantly, those ports are manned with incredibly experienced agents who can pull a vehicle into secondary just based upon, I've seen this before, just based upon intuition. And they also have heuristic models and algorithms that can determine the right time to pull folks into secondary. So there are a lot of reasons why someone get pulled into secondary. But your characterization of drug traffickers is absolutely correct, because a drug trafficker can send 10 vehicles across knowing that 2 may get pulled aside, but that's just built into the business model on the amount of profit, and knowing that the remainder are going to be able to get through. That's the challenge that we have. And even if we were able to reduce that number to C7 and only 3 get through, drug traffickers in pursuit of profits are going to find other ways in order to be able to circumvent that and get the drugs into the country. So what we do by looking at it really in a more holistic fashion is to determine when we see changes in the environment and how quickly we can surge in order to address that change as well. And that's why when we describe it as a dynamic environment, that's what we mean by that.
Well, I'm over time, but Madam Chair, to me, what that suggests is if any of our efforts on the enforcement side just lead creative people who want to make profit to figure out another way to do it, then ultimately you've got to tackle this on the demand side. And so that's prevention, and that's the kind of things you've been testifying to. And if we don't tackle it on the demand side,
Thank you. That will conclude our hearing today, and I want to thank all of my colleagues, and especially I want to thank our witnesses today, Mr. Kemp, Dr. Delphin